Hello, and welcome to today's video. Today, I want to talk to you about antibiotics, specifically why they're so overprescribed, how to avoid taking unnecessary antibiotics, and what should we do if we do have to take antibiotics for some reason. So this story today, this video is somewhat inspired by an experience that I had in my life in the last 6 weeks or so. So I went to the doctor and I was having some pain in my right testicle. Now, you can imagine probably how this goes. So the doctor's like, okay, get them out. Let me have a feel. Let's see what's going on there. With all of his years of experience, he says, this clearly looks like epididymitis. So this is inflammation in the tubes that connect the testicle to basically the penis. And he said this was because of an infection, a bacterial infection, and the solution would therefore be antibiotics. So I asked him, how can you possibly know if there is an infection just from touching it? How can you possibly know if there is an infection that it's bacterial? You know, it could be a viral infection. It could be a fungal infection. It could be something completely different. How do you know? And he said, I just know. I have experience. It's bacterial. Here's your antibiotics. Do you think I took these antibiotics? No, I did not, because I was not convinced that I had a bacterial infection. So now, nearly 6 weeks later, my testicle pain has almost completely disappeared. I went to a different neurologist. He said, I have no indication of any type of infection. And he did not even suggest antibiotics. He basically suggested nothing whatsoever. So you can see this story. If I'd have just done what the doctor told me, I would have taken an unnecessary course of antibiotics. And I want to be the first person to say, and I want to make this very clear, that antibiotics are extremely important medicines. They 100% have a place. And if it is contextually appropriate, not taking antibiotics is very silly. They are one of the most powerful life-saving medicines that we have. However, they are significantly overprescribed, and taking them when you don't actually need them has very significant and potentially disastrous consequences. So it's really important that we figure out when it's appropriate to take them and when it's best to avoid them. And then if for some reason we do have to take them, how do we mitigate these effects? So first of all, let's answer the first question. Why are antibiotics so overprescribed? In this case, why did the doctor prescribe me an antibiotic, even though I didn't actually have an infection? First of all, I think some of it is a little bit of laziness and a little bit of just experience. You know, I can be guilty of this as well. I understand that when you see the same thing over and over again and it sounds like a duck, then it's probably a duck, you know, but sometimes it isn't. Maybe it's a duck-billed platypus, you know, completely different animal. And this happens, but the medical system is very strained. The only way that they could confirm there's an infection is they would have to do a lot of different sampling. They would have to take urine samples. Maybe they would even have to do, I don't know, but they would have to sample somehow. So this might be like a microsurgery. They would have to actually find what bacteria it is or something to then confirm that there is an infection. This is what I would suggest. If a doctor is ever telling you have an infection, like it's an inner ear infection or it's an infection in your lungs or it's whatever it is, you need to know what it is. What is infecting you? Because if it isn't bacterial and you take an antibiotic, not only is it not going to do anything whatsoever, if this is a fungal or a viral infection, an antibiotic will not touch it. In fact, it will actually make it worse. If you have a fungal infection and you take an antibiotic, you will make it worse. And if you have any other type of infection or any other type of issue, antibiotics are extremely immunosuppressive. A majority of your immune system is in your gut, and it's largely influenced and regulated by your gut flora. And if you're given oral antibiotics, they're going to have a broad spectrum destruction of your microflora, and it's going to affect your ability to detox. It's going to affect your immune system. It's going to affect your ability to digest and absorb food. It's going to have a very severe knock-on, which could actually potentially hurt your recovery from whatever acute issue it is that you're having. So sometimes there's a little bit of laziness on the doctor's behalf. Sometimes there's a lack of resources. You know, it takes a lot more money and a lot more effort and time. And sometimes if a doctor thinks this is probably this, let's just jump to the solution. Like this is how doctoring used to work. They used to say, okay, look, this looks like this. Let's do this course of treatment and see if it works. And then if it gets better, then I was right. And then if it's wrong, okay, we'll try the next thing. That's fine. That works really well. Apart from the fact that if you take antibiotics unnecessarily, there are significant negative effects. If you're doing a course of action where there is no real significant negative effect, sure, let's just try it and see if it works. But when it comes to antibiotics and the amount of overuse that we're seeing, it's really advisable to do a little bit more investigation, confirm the infection. And then once you've confirmed it, you can actually make sure that you tailor the antibiotic treatment to be more specifically effective for that. For example, let's say you have a lung infection. This is something that my wife experienced last year. She had a problem in her lungs. She was just given broad spectrum antibiotics, like a penicillin based, like amoxicillin, something like that. These antibiotics are extremely broad spectrum and they will just kill a whole bunch of different organisms in your gut and in all of the rest of your tissues that are not supposed to be sterile. They're supposed to be teeming with life and all of these healthy, beneficial organisms. If we can identify what the specific organism is, we can take more of a narrow spectrum antibiotic. So this is an antibiotic that doesn't just kill everything. It has a much narrower avenue of action. It only targets a very narrow type of organism. This way we can not only target the treatment to be more effective at this specific microbe that we know is creating the infection or causing the disease, but we also don't kill all of those other peripheral organisms that are actually beneficial and healthful, and they help us and they're good for us and we need them. They are essential. So this is a really good course of action because not only is it going to help you more specifically find what the organism is and then find an antibiotic that's specifically effective for that organism, but also if the doctor suspects it's an infection and then it's actually not, they're not going to be able to find anything. And if they can't find anything, there's no targeted antibiotic to give you. They won't give you anything. And then you don't take an unnecessary antibiotic. One of the other reasons that doctors overprescribe antibiotics is they want to provide a fast solution. And I get this. I understand this. Yes, in my case, I did not take the antibiotic, but this took a long time to recover. This took like 6 to 8 weeks. This took quite a long time. And during this time, I was tired. I didn't have much energy. My charisma was very low. My capacity for social interaction was much lower. I'm also fortunate in that I don't have a high intensity job. I would imagine if I had this testicular pain and I was working in construction, or if I was an athlete or I had a job that required a lot of me physically, I wouldn't have been able to work for like 6 or 8 weeks. And for somebody like that, they need a pill. They need a solution. They need something to just get them moving again. They need to get back on their feet and they need to go. And sometimes the placebo effect is a very powerful thing. In fact, the placebo effect is so powerful that this is why we do double-blind, placebo-controlled studies, because the placebo effect biases the outcomes of all of these different types of studies that we do, unless we control for the placebo effect. So there's a good portion of people that will go to the doctor and the doctor will say it's an infection, and then they take an antibiotic. They don't have an infection. The antibiotic doesn't help. It actually just disrupts the flora and causes problems. But the placebo effect is so strong that it overrides all of the negatives that are done. That person can get back to work and they can get back on with their life. So I'm very fortunate in that I'm able to have the knowledge and the courage to not just do exactly what my doctor told me because he said it, even though there was no, in my opinion, justification or evidence as to that course of treatment, and that I could follow my own instincts. And I've been able to build the kind of life for myself where I could take it easy for a couple of weeks and I could allow my body to work through and heal whatever it is that it had going on, whether it was actually an infection or not, or whatever. I have no idea, but it doesn't hurt anymore. So I don't care. It doesn't really matter. So this is why antibiotics are so overprescribed. And this also gives us one good option as to how we can reduce the amount of unnecessary antibiotics. We can ask the doctor lots of questions. We can say like, look, I want to see this organism cultured. I want to see like proof. I want to know what the organism is. You say there's an infection, show me what organism is it? And then let's target the antibiotic therapy at that specific organism. And they can literally do this. They can take that organism out of your body, put it in a petri dish, or put it in like 10 different petri dishes with different antibiotics and see which one is effective at killing it. This way you get a very effective treatment and you can reduce the amount of negative side effects. It's also important to note that this requires a lot of bravery. This requires a lot of courage and self-advocacy. You have to be able to trust your own judgment and you have to be able to do what you think is the right thing. This is very hard, especially if you're dealing with a lot of chronic health problems or if you're very sensitive to pain or discomfort. It can be very, very difficult because you just want that quick solution. It's not maybe so much that you trust the doctor, but it's that you trust the doctor more than yourself. And therefore you defer to the judgment. And as soon as they make a suggestion, you'll just do exactly what they say. So it's really important that we build a relationship with ourselves and we develop our own judgment and health advocacy. And this, for me, is one of the biggest blessings that I have been able to receive as a consequence of all of the health challenges that I've been through and all of my interactions with the medical system. I've learned how to advocate for myself and to trust my own judgment and do what I think is the correct option. So let's say we've worked through all of this. We get to a situation where it is medically required and appropriate for you to take an antibiotic. And this does happen. So for example, if you have a very large laceration, like a very big cut that requires several stitches, it's advisable for you to take antibiotics. If you have some kind of dental surgery, you have your wisdom teeth removed, or you do some type of heavy surgery in the mouth is a very dirty place and there are a lot of organisms. Again, it is advised to use antibiotics. One thing we can do is try to use a topical antibiotic. So again, this is something to talk about with your doctor, but instead of just being on IV, intravenous, or taking oral high-dose antibiotics, let's say it's for this cut, maybe we could look at a topical application of antibiotics. And if it's in the mouth, maybe we could consider like an oral mouthwash or a suspension where we can move this antibiotic around in the mouth and then spit it out and not drink it and consume it, and then therefore negatively affect the flora in the microbiome. This is most easy if this is like a topical issue, if you have like an infection on the skin or like, let's say in the toenail or something like this. This way we can avoid a systemic effect and only focus on the area where the infection is actually happening. So this also reduces the amount of damage that is done as a consequence of taking antibiotics. So if you are going to take the antibiotics, it is important that you do as your doctor states, take the full course. The consequence of not taking a full course of antibiotics is you can build up bacterial resistance inside of your body. So imagine the infection has 1,000 of a certain type of bacteria. And if we take the antibiotics for 5 days instead of the 7 days that we're supposed to, we end up killing 990 of them, but the 20 that are left develop resistance to the antibiotic that you took if we don't kill all of them. So if you are going to end up taking the antibiotic, it is important that you take the full course. Otherwise, you can develop antibiotic resistance inside of your body. And you don't want that, because then you're more predisposed to very tricky or difficult health situations like Marcons or antibiotic resistant C. diff. These are very difficult situations where bacteria have become resistant to antibiotic treatments. So that's a first point, and it's always very important to consider. Secondly, we want to follow up with microbiome support. So whilst you are taking the antibiotic, we want, first of all, to have as narrow of a spectrum of an antibiotic as possible. We also want to try to apply it specifically where the issue is. So again, oral suspension or topical cream instead of just an oral or an intravenous antibiotic. And again, sometimes it is appropriate, but do your best to reduce it as much as possible, given the context, and bring these concerns to your doctor. If you have a good doctor, really, they should be mindful of these things and they should be willing to work with you on these things if you raise these as an issue. But then we can also look at probiotics and other ways that we can support the microbiome. So the first thing is we want to make sure that if you're using any type of biofilm busters, we want to stop them during the course of the antibiotics. It's true that the biofilm busters can break down biofilms so that we can get to the pathogenic microbes so we can kill them more effectively. But we also make our native flora more vulnerable to the antibiotics if we do this as well. So only use a biofilm buster if it is actually medically appropriate and necessary. Otherwise, you are significantly increasing the amount of damage that you do to your beneficial and native microbes. Everyone has this idea that like biofilms are bad and they just hold bad bacteria, and that's completely not true. Biofilms are produced by various different types of organisms, including healthful organisms. And this is one reason that, let's say you get food poisoning or you have some chronic diarrhea for an acute period of time, that your microflora is then able to bounce back because there are healthful colonies that are stored in the biofilms in the body. The biofilms are not always a bad thing. So if you're going to take an antibiotic and it's not required for you to take a biofilm disruptor, you should stop taking a biofilm disruptor. Next, we want to try and add probiotics in. It's important that we take these probiotics away from the antibiotics. Otherwise, the antibiotics will just kill all of the probiotics and you will have no benefit. Normally with antibiotics, you have to take them 2, 3, or 4 times a day. What we want to do is try to take the probiotics in between the antibiotic doses. So let's say, for example, you have to take an antibiotic at 9 o'clock in the morning, 2 o'clock in the afternoon, and around 10 o'clock at night before you go to bed. What we want to try and do is fit your probiotic dosages in between these antibiotic dosages. So we want to get the time that you would take the antibiotic and we want to find the midpoint between them, and that is the best time for you to take your probiotics. Ideally, you want to take them at least 2 hours away from an antibiotic dose, but you just have to do the best you can. If for some reason you have to take 5 doses a day, just take it in between as much as possible. If you're only taking 1 dose a day or maybe 2 doses a day, like morning and evening, just take them in the middle of the day. It honestly really doesn't matter when you take them. As long as you're taking them, they're going to get in the system and they're going to have that beneficial effect. The next thing that we can do to support your body is to consider eating food that is a little bit more gentle. So your gut flora plays a really important role in digestion and absorption of foods. So whilst we are taking antibiotics, we still want to make sure that we're providing as many of the prebiotic and polyphenolic compounds as possible, but we just want to be mindful that the digestive system might be a little bit more sensitive and it might be struggling to digest more complex foods. So this might not be the time to have like deep fried oily food. This might not be the time to have like a massive salad. These things could be a little bit more difficult on the digestive system. Instead, we want to think about like poached salmon and soups, warming foods, things that are broken down and more easy to digest. Things like bone broth and apple cider vinegar could be really helpful in a situation like this. Could also be really nice to include lots of herbs and spices. These have prebiotic and polyphenolic effects. So this means that they are not only prebiotic, but they are also antimicrobial. So this means that when we're taking the antibiotic, we could inhibit the growth of potentially pathogenic yeasts or other organisms. And we can also support a normal return to a floral balance after we finish taking the antibiotics. So I would probably follow this kind of rough suggestion for 2 weeks after the conclusion of taking the antibiotics. So continue to take the probiotics and continue to support the digestive system and keep things a little bit more gentle. As I said, boiled foods, soups, things like this. And finally, I think it's really important to emphasize that it's not the end of the world. Yes, taking antibiotics will damage your gut microbiome. In fact, I have seen it said that for every course of antibiotics that you take, you reduce the flora diversity by about 1/3, and it takes 10 years to restore 90% of what you lose. So yes, it will do a significant amount of damage. But you have to remember, your body is strong. Sometimes antibiotics are necessary. And if it is actually appropriate for you to be taking these antibiotics, it is the best thing that you could be doing for your health. So you just need to do the best that you can and surrender the outcome. You literally cannot do more than your best. It is absolutely impossible. So just make sure that it really is required for you to be taking the antibiotics, and then do everything in your power to support your body in mitigating any of the damaging or potential side effects that could be caused as a consequence of taking them. So don't sweat it. Remember, modern medicine is an absolute miracle. We've saved so many lives with antibiotics. If it's medically appropriate and you're in good hands, you absolutely should be taking them. Just make sure that you support your body in any of those potentially damaging side effects and take care of that gut flora and support your digestive system a little bit extra during that time and just after you finish concluding taking them. And if you feel like you've taken a lot of antibiotics, maybe you've done 3 or 4 courses in the last 10 years or so, and you feel like your microbiome is a little bit damaged, maybe you're hinting at some leaky gut, some histamine symptoms, a little bit of bloating, gas, IBS, you're seeing some autoimmune diseases begin to creep up, and you feel like you want a little bit more help with supporting your gut and influencing your microbiome in a beneficial way, be sure to reach out, shoot me an email, support@williamdickinson.co.uk, and we can take a look at figuring out what a personalized approach towards gut health and microbiome diversity might look like for you. So I hope you found this really helpful. Take care, and I'll see you in the next video. Bye.